Good afternoon. This is Denise Simmons, and I'm proud and pleased to be with you this afternoon as we have the sixth installment of what was a five-part series, but we wanted to continue to get the information out and continue the conversation. So we're in series episode 6 of series session 1 of COVID-19 in the Black community. Again, good afternoon. I'm joined with my co-host, Manikka Bowman. She's the vice chair of the Cambridge School Committee. We're both here to talk to you today about COVID-19 in the Black community. The storm is not over. As many of you know, that we have been dealing with, living with, working through this pandemic, and it has hit the Black and brown population disproportionately. And we wanted to take a moment just to talk with you again about the pandemic, what's happening in our community, some tools, some things that we should know to do and do in our community so that we can keep ourselves not only healthy, but safe. And so it's really a pleasure to have these wonderful folks with us who they're going to introduce themselves in a moment. But before I go to them, I want to go to my co-host, Manikka Bowman. Manikka?
Yes, thank you, Denise. I am elated to be here. Happy Sunday to everyone. And what's interesting, Denise, about this episode of our series is that I get to wear multiple hats here, right? So vice chair of the Cambridge School Committee, but I get to be Reverend Bowman with my colleagues. So I'm excited about that as well. And, you know, our guest that's here with us are some people that I have so much respect for. So I'm excited to get into this conversation. There's so much happening within the Black POC community. And I really believe that our guests here today will really be able to help us, you know, think critically outside the box on, you know, how we need to move through this, because as the title of today's program states, the storm is not over and we need to prepare accordingly. So let's get to it.
Thanks, Manikka. So let's get to it. So with us, you'll see on your screen a number of our guests, and we're going to allow our guests to just start by introducing themselves and what they do. And then we're going to come back around and go back to Claude Jacob to lead us off in discussion by giving us an overview of the pandemic in Cambridge and what our numbers look like and some other important information. So Claude, I'm going to start with you, give a brief introduction about who you are and what you do, after which we'll hear from Dr. Bell, then Reverend Thornhill, and then after which Reverend Ellis. So Claude, floor is open.
Thank you, Councilor Simmons. And again, thank you for this wonderful opportunity to at least provide a brief update. I'm Claude Jacob, and I have the honor of serving as the Chief Public Health Officer at the Cambridge Health Alliance. And in this role, I oversee the nationally accredited Cambridge Public Health Department. So bidding you greetings from our crew on the ground. With that being said, I've had the honor of being in this role for the last 13 years. And each week I provide an update through the city manager to the city council, just so folks are aware of what the landscape looks like, especially over the course of these last 5 months. With that being said, for this afternoon, I did want to at least set the tone with some global, at least stats. But at the end of the day, I'm looking forward to the dialogue with colleagues on this panel. So in broad strokes, just to tee it up, the landscape, the number of COVID positive cases reported to our department over the course of the last few months. So we're closing in at 1,200 cases of confirmed individuals here in the city. Sadly, we've had 99 individuals who have perished, who have died as a result of this, the COVID virus. Just know that the lion's share of those fatalities have occurred in our long-term care facilities. So 75% of those fatalities have been in our long-term care facilities. While things remain steady in terms of what we're seeing here in the city, just know that we have done our best to make sure that we continue to push the envelope with messaging and testing, just to make sure that we can protect the residents and guests here in the city. Just know that what we've been reporting to our residents are the area hotspots across the city. And in particular, we're looking at East Cambridge, North Cambridge, and the Port and Cambridge Port. Why? Based on the data that we report out each week, if you look at the data that we present each night on the city's website, we show the number of cases, and we call it a heat map. So it's easier for folks just to follow along each day, just so they can see the progress from day to day and week to week. So that pattern has remained the same since the last time I was here, I believe on June 7th. So we have not seen a whole lot of movement tied to what we're seeing in terms of the hotspots, as we call them. But for this afternoon, I did want to at least share with folks why we remain vigilant. It's because, again, while it is summertime and it is vacation time and folks want to let their hair down, this virus is not taking a vacation, and we know that. If you look at the number of cases across the Commonwealth, if you look at the number of fatalities around the globe, just know that this virus is not taking a break. And today we're talking about the color of COVID, and the subtext being that it tends not to come in pastel colors. And so just know that we're talking about the disproportionate burden in communities of color. While the burden itself has been disproportionately among Black and Hispanic Latino folks, Black and Brown folks, we do know that the fatalities themselves have actually impacted the white population, especially those in the long-term care facilities. So we do at least want to make that distinction. And for today, we'll talk about how we can do a better job with messaging, what else we can do to engage other folks like each and every one of you to be ambassadors, to spread the word. We really want to make sure that as we enter into the fall season, enter into the winter season, really thinking about the next year plus, what else we must what we must do to at least remind folks of the importance of applying the hand hygiene practices, maintaining social distances, making sure that we adhere to the requirements around wearing masks or facial coverings. But at the end of the day, if one is sick, we're asking folks to just stay home. We know it's tough, but we're asking folks to continue to do that. So let me pause there. We'll talk more about the data and opportunities around the bend, but I really appreciate this opportunity just to share with you what's happening on the ground at our health department.
Thank you, thank you. Dr. Bell, can we hear from you by way of introducing yourself?
Sure, and thanks again for having me with this esteemed group of colleagues. My name is Dr. TAISON Bell. I am a critical care and infectious disease physician at the University of Virginia, and that pretty much means that I've been dealing a lot with COVID-19 since it entered our shores. In addition to working in a hospital, I've been involved in a lot of the operational response to COVID-19 in the hospital and in the community to produce PPE, get public messaging out, and try to do what we can to fight the course of the virus. Virginia is in a little bit of a different spot than the Northeast, but it's a problem everywhere in the world. In addition to being a physician on the front lines, I have a wife who's a singer whose career has been affected by COVID-19. I have a 6-year-old school-age child who's been affected. So this intersects with me very personally. I've also had an extended family member who's died of COVID-19 as well as my wife. So I'm here to speak as a professional, as a person, a human being, and try to give the best information that I can, and ready to take questions and have a good discussion.
Thanks, Dr. Bell. Reverend Thornhill, welcome. Please, by way of introduction, tell us who you are, what you do, and we'll go from there. Reverend Thornhill.
Good afternoon, everyone. Thank you again, Councilor Simmons. Yes, I'm Reverend LORRAINE Thornhill. I'm the pastor of Kingdom Empowerment Center in Cambridge, Massachusetts. Been there now about 22 years. And also I'm the president of the Cambridge Black Pastors Alliance. Also serve as one of the chaplains for the Cambridge Police Department. Also serve as a board member for Cambridge Community Foundation, and do other things within the city of Cambridge. So that's all I'll say for now, and then we can have a discussion.
Great. Reverend Washington.
Hi, thank you for having me. I'm also very honored to be a part of this discussion. I'm ELLIS Washington, pastor of the St. Paul AME Church in Cambridge, Cambridge's oldest Black church. Excited not only to be a part of this conversation, but also to talk just in terms about spiritual, mental, emotional health as well as it relates to the context of COVID-19. Also blessed to serve on the board of the Hildebrand Family Self-Help Center, which serves homeless families, something that started as a ministry of St. Paul AME Church.
Thanks, Reverend Washington. Earlier, as we launched our program today, Claude, you mentioned we had this conversation back in, I think you said June. And we had the conversation in June because we wanted to know what was the impact in the Black and Brown community. The only little difference we're going to have today is, and why you have Reverend Thornhill and Reverend Ellis and Dr. Bell, is to talk about how can we be more effective to getting to the Brown and Black community. You know, we see the numbers are high. We know there are testing centers available through efforts through the city. We've made those testing centers mobile that we go around to East. We've been in East Cambridge, we've been in North Cambridge, we've been in the port, trying to be a presence in the community to get more Black and Brown people to take the test. So first of all, I want to just ask Claude, specifically talking about the numbers. You talked about the heat map, but can you drill down a little bit about in terms of positivity rates in our community? And then I'd like folks to just kind of jump in to talk from their perspective to talk about how do we get our community to get tested? What are the impediments? What are the fears? And then, you know, Manikka, I want to have you wear both your hats today. You know, our parents reacting to sending their kids back to school. So I know that's a lot. We only have an hour, so let's just jump in. Claude, give us a drill down a little bit on that information in terms of positivity rates, and talk about what are you seeing at testing centers. Unmute yourself, Claude, unmute.
There we go. All right. Thank you again. And it's really an opportunity to share with you. So in short, in terms of what we're seeing, so as many of you may know, the city is divided in these 13 neighborhoods. And the reason that we decided early on to pay attention to the patterns is that we wanted to make sure in real time we're capturing at least what we're seeing as the reported number of positive COVID cases attributed to each of the neighborhoods. Initially, we were looking at the 5 zip codes. We drilled down to the 13 neighborhoods. And my comment earlier was simply to acknowledge we're seeing the same patterns that we saw a few weeks ago that, for example, in North Cambridge, reported to our department, we have 130 cases attributed as COVID positive individuals. In East Cambridge, it's around that same number. But the other extreme is that in the area, in MIT, in Area 2, as they call it, we only see 8 cases, or in Strawberry Hill, we only see 19 cases. And so we say that to say that we each night provide this map just so folks can see at a snapshot what that looks like. And that's available at cambridgema.gov/COVID-19. So just know that each night one can see the same map that we're talking about. We also provide at least cases per 10,000 residents. And that's a little bit a better way to show apples to apples. And when we do that, we show that the Port and East Cambridge have the highest rates across the 13 neighborhoods. So the Port, for example, would show 130.4 per 10,000, and East Cambridge shows a rate of 126.7 per 10,000 residents. So that's the high water mark. And on the low end, we would see 16 or 27 cases, depending on whether it's the Agassiz neighborhood or, again, Area 2 and MIT. So why do we share that? It's really an opportunity for us to see in real time, based on the individuals and the address that's assigned in that particular neighborhood. And it gives us at least a way to gauge what's happening. And we can talk more about who actually lives in those particular neighborhoods and why that could be. I did want to at least make one other comment in terms of the data that we look at. We do know that in terms of when we break down by race, ethnicity, and gender, we do see that more women versus men have been reporting as COVID positive individuals. And if you drill down, at least the biggest disparity is within the Black community. Again, we can talk about why that is, but just know that when we're looking at the data and we're tabulating this, we're seeing this, that it's consistent across all races, that more women than men, but in particular, we see a bigger variation or difference in the Black community, again, men versus women. So with that, I just want to say that in terms of the burden of COVID, we do see that it's impacting disproportionately more the Black and Brown community. So when we look at the data, we see that nearly 3 times as many COVID positive cases are attributed to Black residents versus white residents. And that same difference in terms of Black and Hispanic, Latinx or Hispanic residents, it's literally nearly 2 times. Again, why is that? We're still trying to figure out whether it's tied to occupation, whether it's the actual neighborhoods. We do know that there's some intersectionality tied to socioeconomic status and one's race and ethnicity, and that's the same pattern that we're seeing from coast to coast. So we can flip it to see what else we could do more here in Cambridge to message this and at least bring it to one's attention. But at the end of the day, that's in broad strokes, at least to tee it up so you can get a sense of what we're seeing on the ground.
Thanks, Claude. Dr. Bell, from your vantage point, for someone who's literally on the ground with this pandemic, can you give us some of your thoughts in terms of positivity rates and what you may even think could be? And I'm going to come to you, Reverend Thornhill and Reverend Ellis, to talk about why can we not get more of our folks who are clearly higher in the numbers into these testing centers? But Dr. Bell, I want to hear from you as a practitioner, as someone who is on the ground. Give us a snapshot of the pandemic from your perspective, from your point of view.
Sure. So the pandemic has really ripped a hole and exposed a lot of the inequities that we have in society, both when it comes to how we work, how we play, where we live, and the kind of lives that we lead and how healthy we are. This has had an ability to cut across all of these factions in a way that I hadn't ever seen before, and an opportunity to talk about this. So we definitely have a lot of problems when it comes to inequities and everything that ties back to structural racism, as far as where Black and people of color live, where they work, where they recreate, and what kind of communities that they live in. That connects back to how society was initially structured to favor one group over the other. So what we're seeing is a symptom of a disease. The disease is racism, and that's what we have to attack. So from a medical perspective, I think about the 3 T's when it comes to COVID: testing, treatment, and contact tracing. Those are the 3 things that we have to do to get on top of the pandemic. So let's take it point by point. So for testing, there's a lot of talk in the country about testing and how we need to expand it. Some people say that we have enough, and that's why we have more cases. The people who say that are absolutely wrong. When you look at the country compared to other countries that have had relatively good control of the virus after initial outbreaks, we are not testing enough. We're not expanding it enough. And our percent positivity, meaning the amount of people that we test to pick up our first positive, it's much lower than other countries. So for instance, in our country, we test about 12 people to pick up every positive COVID-19 case. In Europe, for instance, and many places there, it's 1 in 150 or 1 in 250. So they're testing many times more people to actually find a positive, which lets you know that it's much less prevalent in those communities. They were able to shut down much more aggressively than we were. And we have mixed messages and politicization around what we should do to keep ourselves safe. And unfortunately, that has backtracked and made the Black African American Latinx communities a lot less safer, because what we know is that Black patients in particular are almost 4 times likely to die of COVID-19 than their white counterparts. Latinx 2.5 times more likely than their white counterparts to die. Now, the question's been raised: is it something genetic or something about being Black or Latinx itself? And that's not the case. What it connects to is the comorbidities that a lot of people of color will tend to have when they contract COVID-19. One of the factors, so rates of obesity, high blood pressure, heart disease, kidney disease. These are all medical comorbidities or chronic conditions that will make you less likely to be able to combat COVID-19 effectively once you contract it. And it's hard to have a discussion about these factors if we're not talking about food apartheid and lack of access to healthy food, lack of access to good education, the racial disparity, wealth gap, the fact that people of color are more likely to live in dense multi-generational housing and to have more exposures within a tracing or within a household if someone becomes positive with COVID-19. The fact that people of color are more likely to work in service sector industry and healthcare industry where there's more patient-facing and customer-facing interaction. So, we're not as likely to be able to shelter in place when that's the instruction, when we have to go out and work in the community. So for instance, when 12% of the population is African American, but they make up a quarter of the public transportation sector, these are people that are in face-to-face interactions. My dad was a public bus driver for the MBTA for many years. And I recall the story of a bus driver in Detroit who posted on Facebook about someone who was coughing on the bus, not covering their mouth. 11 days later, he contracted COVID-19 and died. So, these are the barriers that we are facing. That just comes to the testing. When it comes to treatment, we also have disparities in how people of color receive healthcare compared to their white counterparts. Hospitals that tend to treat heavily minority populations tend to be understaffed, underfunded, and have a more burnt out workforce that are less safe than other hospitals. I recall a story in New York City where one hospital had access to the latest treatments, had clinical trials that were able to enroll their patients in. They had lots of PPE or personal protective equipment. And then, maybe 20 miles down the road across the river in another hospital in the same city, much different story. And this population was heavily minority, much more so, which means their workforce was more heavily minority, which means that they were more likely to live in dense, crowded housing situations, and staff were more likely to get infected because they did not have access to PPE. There was a point in time in this country when the hospitals that had access to private jets that could go across the ocean to go to China to get PPE were able to bring that back and make their staff safe. And obviously, a lot of publicly funded institutions do not have that sort of access to resources. So when it comes to treatment, we need to make sure that our institutions that treat people of color have equal access to these novel breakthrough therapies, that they have access to the PPE to keep their staff safe and ultimately the patients safe. So that's treatment. And then the third is contact tracing and isolation, because it's really nice to know if you're COVID positive or not, but then you need to know what are the next steps. So what do I have to do? Because we know that this virus can spread within the community with a rapid pace. A lot of times because you can spread it when you're mildly symptomatic or you have no symptoms at all in some cases. So it's really important to test aggressively, not have a long turnaround time like we've been seeing in some spots, that we can get contact tracers into these communities and make sure that people know what to do. Now, the question becomes, you tell someone who lives in a multi-generational household where there's no place to isolate and they're COVID positive, what do you do now? You have to have a plan for that. So you have to have set up a place where people can go to isolate themselves for the recommended 14 days to prevent others in the household and others in the community from becoming infected. These are problems that we can anticipate are going to happen, but there's not been a succinct, coordinated response to make sure that we can deal with what happens when we test and have the need to isolate patients who may not have that ability to do so because they don't have large houses with wings in different parts of the place that they can go. We also have to talk about, in the context of schools, service sector employees who depend on showing up at a place of employment to get a paycheck. So their child is sick and can't go to school. That's very different because they may not have the ability to keep their job if they have to stay at home with a sick child. And we have to, again, anticipate that problem, prepare and make an action plan for it so that parent can get that support. So, there are many different things that we can talk about here because COVID literally intersects with every part of the fabric of our society. But I think from my perspective, the key is, there's a fair amount that we don't know about COVID-19 and how it's going to affect the population. But there are certain things that we do know. We know that it disproportionately affects African Americans and Latinx communities. We know that if you have chronic conditions, you're more likely to have a worse outcome. We know that if you go to a hospital that's underfunded and without PPE and access to that, that you're more likely to have a worse outcome. So there are some things that we can anticipate and try to mitigate ahead of time if we have a good coordinated plan for it. And then the rest of it, we're learning as we go along the way, but we need to have our eyes focused and looking forward ahead.
Thank you. And you used the word just now, you said mitigate. When I look to Reverend Thornhill and Reverend Ellis and thinking about mitigation in terms of what are our communities of color doing to mitigate the disease? Because the first thing is, let's not get exposed. Let's not get the disease. So could you speak just a little bit, Reverend Thornhill, about what is your faith community doing? And also, so we can share, maybe tease it out, what do you see as some of the impediments? So what kinds of things are you trying to do right in your faith community to keep congregants healthy? But what also are you seeing as impediments?
I think what we're doing is just giving education so people have the facts. Mm-hmm. So we've had discussions about it as a group. giving out information, whether through the website, Facebook, whatever, letting people know about testing, letting people, I think some people said, well, we get different information. At first it was like, oh, you don't have to rush to get testing or get testing. Everybody needs to get testing. Or if you just felt sick, stay home and quarantine for 14 days. So now people are saying, go out and get tested. And so then there are folks, as Dr. Bell said, you have people that live in multi-generational, homes and families. All right. When I think it was Dr. Fauci says, oh, if you become positive, try to use a separate bathroom. Most people only have one bathroom. They don't have two bathrooms that they can say, or, sleep in, upstairs, downstairs, or whatever, different places. A lot of people don't have that. So I think that's one of the impediments. You can give all the education, people can hear all of this. Then you have people that have to go out to work. I know folks who have to work. They are essential workers. Some of them, looking at it where I don't get paid if I don't work. So if I don't have no symptoms, why would I go and get tested? In some ways, it's like, okay, then you tell me I've got to quarantine for 14 days. I don't have no symptoms. I'm feeling good. I go get tested, find out I got to be quarantined for 14 days. Then who's helping me, with my, rent? Who's helping me with, groceries? Who's helping me with the children? All these kind of things. So I think there's a fear that also goes on, a fear of the system. All right. If I go get tested, who knows about this, even though they might say, oh, no, we're not letting anyone know. I hear Dr. Bell talking about the contact tracing. I heard many people say, well, what does that really entail? You're calling me up or I've got to let other people know who I've been in contact with. What about if I don't really know everybody's status, immigration status? What if everybody, and even though we could be a sanctuary city in Cambridge, there's that fear. And so I think you have a lot of different factors. We can give all the education that we want. We can urge people to go, but there are some serious fears in our Black and Brown community about why they should go and get tested.
Dr. Thornhill, this is Dr. Bell. I wanted to actually dig into that a little bit more. I think it's a very insightful comment that you opened up. And, one of the things that we have to deal with and address, straight on is a mistrust that many African Americans in the community have of the healthcare system. What often is not discussed is that this is an earned mistrust. Healthcare has worked extremely hard to get on the bad side of Black people. If you can go back to, I don't even have to go back that far, Tuskegee experiment where the federal government funded the natural history experiments of syphilis in African-American men and told them that they were going to treat them when there was access to that treatment. But Henrietta Lacks, who the family celebrated her birthday just yesterday, the family posted about that. Her genetic material was stolen and used to fund billions and billions of research to start multiple companies, and they received no compensation from that. When early on medical school training, when graves were robbed and Black bodies were stolen for the purposes of teaching anatomy to medical students who were largely white, we've worked extremely hard to get on the bad side of Black people, and these stories have been passed down from generation to generation. So it is very arrogant and not very understanding of the history when you come into the community not prepared for that backlash and say, we're going to do wide-scale testing. We're going to do wide-scale contact tracing. Give me your cell phone number. Give me where you live. And this is how we're going to keep you safe. When historically, this is exactly how Black people have been taken advantage of by the medical establishment. So, we do have protections in place to make sure that, information is not abused and it's not used for purposes that it wasn't intended for. But it's incumbent upon us as healthcare providers, as community leaders, to make sure that our messaging addresses that painful aspect of our history. That this is a trustworthy effort in order to do tracing and testing so that we can isolate and ultimately keep you safe. We definitely have to address that aspect of things.
Thank you, Dr. Bell.
Yes, I think it in line with what Reverend Thornhill has said, we are also trying to educate and keeping a dialogue open. We've had weekly calls with conference calls on Zoom with a focus of information and inspiration. We do just a brief meditation, but also go into discussion with someone who has expertise and knowledge on not only the physical health and how to stay safe, and just reminding us weekly how to protect ourselves, and thinking also about the broader picture of the pandemic, and also doing focus on emotional and mental health, because everything has a context. And certainly this COVID-19 is in the context of racial injustice and unrest and protest and all of these things. And it obviously plays on the mental health, the emotional health of people. And so these are opportunities to do check-ins, to talk about how do we talk to ourselves, or how do we describe our feelings, and opening up and those kinds of things. And in light of everything that's just been said, especially the historical mistrust of the medical delivery system among Black and Brown people, for all the reasons that have already been mentioned, it just adds to the angst, the mixed messaging. We heard that earlier. The messaging that at least nationally, everybody who wants a test can get one, when that wasn't true. And then if you don't have any symptoms, don't worry, about trying to get a test. And then, now we're saying, okay, it's free, go get a test. And there are people who are just skeptical. Some are afraid of the method of testing, and thinking that it may be highly uncomfortable. And in fact, how many times have we heard in the Black community on other health issues, well, if I got it, I just don't want to know. And unfortunately, that's very real. And we have to continue to work with that, because that's not something that just popped up overnight. That's a feeling that we've carried as a community over a long period of time.
Well, and I think Dr. Bell was absolutely right. I almost jumped out of my chair when you said the health, not department, but community has earned our mistrust. And leading off with, the Tuskegee study. My mother grew up in Tuskegee. She sat right there in the front seat of what was going on with that study. So you are very right. We really need to talk about messaging. But Claude, you wanted to say something, and then Manikka, I see you want to. You look like
I'm ready. I'm ready.
Let me hear from Claude, and then we're going to go to you. So Claude, you want to say there's something you wanted to say?
Yeah, two things. Again, Dr. Bell, really appreciating your comment. You talked about the 3 T's in terms of testing, treatment, and tracing, but you've also alluded to the 4th T, which is trust. And so the power of the trusted source, we talk about it a lot in terms of the work of governmental public health. Clearly, it's been a conundrum of sorts, not just the messaging, but just trying to demonstrate why it is that folks ought to trust the manner in which we do our work. Recognizing the history, I just appreciate your comment, but do want to flip it to say that in Cambridge, at least in this magical kingdom, we have done a lot tied to testing. The reason I mentioned those hotspots, because that's where we've offered and located the mobile testing, just to use the science of our work, going to where we see the burden, especially in those neighborhoods. So just wanted to underscore your comment about trust, but also acknowledging why it is that we've deployed the assets and the manner in which we've done that, which I'll talk more about in the next segment. But thank you for that comment.
Manikka, you wanted to ask a question or follow up?
Well, I want to follow up, and I'm keeping an eye on our Q&A too that's coming in for our viewing audience. But I'm hearing this theme within the conversation, and really I'm feeling it because as the vice chair of the school committee, I feel like I'm on the front line of governmental failure. And what I'm hearing in this conversation is that it has this trickle effect when there is a lack of leadership that really has the capability to be able to understand all of those historical contexts, of course, but also recognizing the complexity of the moment that we find ourselves in and being able to lead. And so whether that is with 45 at the highest level of government, to where we are with this conversation around reopening schools or not, there are these huge portions of the conversation that's just simply not happening. From where I sit, I read the emails from individuals who are scared to death if we don't reopen schools because they will lose their job. And we know that Congress is fighting right now, going back and forth about whether or not to renew the $600 benefit when it comes to unemployment, right? And we have people that fear sending their kids into a building, and all of those conversations have legitimacy to them. And the challenge that we find ourselves in, instead of having a conversation between 3 feet of space versus 6 feet of space, we need to have our leaders at the federal and state level putting in regional metrics that will then allow decision makers, whether that is a house of worship or a school department, to know what are the case counts when we know that we are safe or not, because none of that is taking place. When it comes to having a framework for the private sector to open up so business can move forward, there's been some intentionality as it relates to our state leadership around that. But when it comes to the nuances of our everyday life, to know whether or not we are safe, people don't have a sense of that. And so I think it's really important for us to keep all of that and really be able to lean on, I think, the good leadership of Cambridge. I feel very fortunate to live in Cambridge, where we do have leaders that's trying to figure this out. But I thought it was just really important to be able to hold those things up. Literally, our government, the way it is set up right now, is creating a lot of the anxieties that we find ourselves in.
So what came up a couple of times was messaging. And I just really wanted to hear everyone's idea or point of view. Dr. Bell, you said there's a great deal of mistrust, earned for the right reasons. How do we get the right messaging? Because you could literally have whiplash trying to listen to the different messages. And my sister, Miss Bowman, mentioned 45, which I just got to say no swearing on the program, was, he's doing something, and some people do listen to that, and then there are other people, particularly our young people, that hear our numbers are going down, Claude, and they get lulled into this thing about, well, it must be better because look at our numbers, California, Georgia, Florida, raging. Look at our numbers. So it must be okay. And okay to some people means take off the mask and get all up in some people's faces. And I think this is particularly interesting with the church community, because we're a hugging group, a bunch of people, and we want to embrace when we meet each other. So, how do we get accurate, aggressive? I want to hear people's ideas on what should we be saying and how do we say. Manikka.
Denise, can I add on to that question? Because I know that's something that I see a lot via, social media. We're starting to see these trends of the mask down and the photo ops and, and the way in which people are interacting with each other. I was in the Seaport and people were living their best lives, eating and dining. And I know that the state has allowed certain things to open up, but I think we need to be clear in our messaging, what is safe and what is not. And I would love to hear from our medical professionals, as well as hear from our good reverends around how they're combating that challenge right now.
So the floor is open, gentlemen. Who wants to jump in?
Yeah, so, and I'll defer to Dr. Bell in particular, but let me just say that what we've done, at least from the vantage point of the health department, is to make sure to push as much messaging out there. The basic principles around hand hygiene. Washing your hands, that's basic, but we've had to remind folks. The masks, I would say that there's been a cultural shift, again, tied to the conundrum from what we heard months ago, tied to the federal partners. There was a little bit of a disconnect. Let's conserve the mask for the frontline healthcare workers. Well, now let's make sure that everyone at least wears a mask or a facial covering. So part of the challenge is for us to recognize that this virus, we've had to be nimble, we've had to be agile to address and to respond to whatever the latest guidance has been. So recognizing that this is a moving target, I would say that the best asset we can have is to make sure that we empower folks on the ground, like members of our faith community, to help push the message back out. So I would say that that has been the biggest conundrum these last 5 months, is that this keeps shifting. Just like any winds, it keeps shifting, and all you can do is adjust to the need on the ground. So our core messages remains the same. Look, we remind folks to practice hand hygiene, wash your hands. We remind folks to wear a mask or facial covering, especially if they can't maintain that 6-foot distance, from one another. Why doing that? It protects you from me and me from you. And so there is a way for us to at least continue to remind folks, even in the summertime, that it's recommended and required that we ask folks to at least be more courteous with wearing the mask or facial coverings. But at the end of the day, there's no substitute for staying home when you're sick. That for us has been a bigger challenge, especially, again, if Dr. Bell can concur that 2 out of 5 folks don't show symptoms. So that has been a little bit of the challenge in terms of the messaging to remind folks, don't let your guard down. Let's be courteous, but at the end of the day, let's protect each other.
Dr. Bell?
Sure. So, the first thing I should say is that even if we had consistent messaging from trusted leaders who could stay on message, this would still be hard to communicate. This virus has really hit a sweet spot with its ability to spread, its ability to cause human disease and suffering, and our knowledge of it has to evolve as the pandemic is happening. So, I remember early on, I've been talking about this and doing a weekly series for the past 20 weeks or so about COVID-19. And I remember at one point we were talking about the public not wearing masks. We were in a different situation. We had a strain on our PPE supplies, and people were going up and buying medical masks, and that weren't going to frontline providers. And so the recommendation from the CDC at that point was the public does not need masks, and we reversed on that. So even if we had a good, consistent messaging, this is hard because things have to evolve, and there has to be patience and understanding and earn trust. We come back to this word trust, that your public health leaders are trying the best that they can. We're using the science as it evolves. And as we learn more and more about the virus, our recommendations will ultimately change about, what we recommend for it. So, that's the first point. The second point, if your leadership at the very top who sets the example for the rest of the country is actively subverting the message, not listening to the public health officials, tying the belief in him to belief in whatever he believes in, that's certainly not helping things, because there's a large segment of the population who believes what 45 says, no matter how false it is. And that's extremely unhelpful and frustrating as a healthcare provider, knowing that more people are likely to die and suffer. When the country gets a cold, Black people get pneumonia. And that saying that my grandmother said so many years ago is true. And the result of these uninformed decisions is going to lead to more suffering in our communities. But the last thing I'll say is that, as far as our understanding about the virus now, what we need to do and how we get this message out is really to just reinforce the constant vigilance that we need to have. Massachusetts has relatively much better control over the virus than many other states in the country right now. And that's a good thing. But that's not an excuse to let up your guard. So it still means that you should avoid, especially crowded indoor spaces, and any indoor spaces really, if you can. Go out when you need to, wear a mask or a face covering. It's certainly good to be outside, and I like fresh air, but you never know if you're going to come into a situation where you're going to be around a lot of people. So when I go outside and I'm not around a whole lot of people, I'll say I'm in a park, I won't have a mask on, but I have it on me, so that if I'm coming close to people, I can just whip it on and put it on my face. And my children, 2 and 6 years old, they know how to do the same thing, and they know how to stay away from people. So we reinforce that message to make sure that it gets through to them, that they understand how important this is. When it comes to young people in particular, because a lot of conversations that are around young people. I remember images from Memorial Day weekend of people crowded on the beaches and in bars and in the streets and things like that. I remember being that age, and it's not a particular age where you listen to people's advice and you feel invincible and you behave like you are invincible. But this is not the moment where we are embracing our individual risk and behave according to that. We really need to think in the collective. How do my actions, how can they lead to someone else becoming sick, someone else dying, connecting that to someone in your own life that you love and cherish who could potentially get sick if you go out and do something stupid. So what I found works with the people who are in this naturally rebellious phase of life is that you reinforce how collective our responsibility is to one another and how we keep each other safe. Remind people that my hope is that this is temporary, and meaning like a short temporary, that we get a vaccine relatively soon. I don't know if that'll be the case, but at some point this will pass. My hope is that we're not going to live the rest of our lives this way. Certainly no one expects that. But for the time being, we do have to be extra vigilant, particularly because this is a silent killer and it can spread even if you don't have symptoms. It only needs time and opportunity to spread. And the more that we can reinforce that message, keep it consistent. I wish it was coming from the very top, but it's not. It's on us to get that message out.
Yeah, I'm going to jump in and pose a question to our faith leaders, because we know that the institution of the Black church has really been a pillar, quite frankly, within our community. And my beloved significant other actually showed me this really interesting article out of Atlanta, where there's this big gigantic poster board, billboard, excuse me, that was an open invitation for Black people that were questioning faith and building a community around it. Now that's a whole nother conversation. But one thing I can say, that the Black community has always served as this place where information can be had and discussed, and a place for organization. But we look at the civil rights movement. We just celebrated the life of John Lewis. A lot of that came and was birthed out of the Black experience. So my question is, how do we hold on to the value of the Black church in the context of a pandemic, so we can leverage our institutions to serve our communities well?
I think it's important that we continue to do what we have done as the Black church, and even do more so. And as you've said, to be not just spiritually minded, that we are not engaged in the public sphere, and that we are not thinking about issues and advocating for issues of social justice. We do have some benefits. We are an organization. We are already organized. And so to put that collective strength and power to use, not only to provide information and to keep people informed, but to marshal that strength on issues that are of importance. I think there has been a disconnect at some point, and I think there are those persons who have not seen or begun to question the efficacy of the Black church in terms of touching everyday life issues. I think that's something that we have to reclaim. It certainly was very, very much true when the church and the civil rights movement were linked together. The civil rights movement came out of the Black church experience. I think it's also important. I think the church has that dual role. So yes, we're helping to inform voters and register voters, and we're helping to share information that might not be trickling down to our members if they're not plugged into the right outlets and networks. But it's also talking about those issues that are greater than ourselves. It's pointing us to something bigger than us. And I've said to so many people, I would not want to be a person without faith going through this crises or these crises. I'd want to be someone that had a connection to something greater than myself. So that's a part of what the church is doing, while doing the other at the same time.
And to add to what Reverend Washington was saying, I think what's happened to the Black church is that we got comfortable and we moved inward in our thinking and how we were supposedly reaching out. We were reaching out not in a way that was strategic. So because of this health pandemic and the racial pandemic, it's pushed the Black church back out again, back out into the streets, back out, taking care of one another, how we're lifting up one another, speaking out, speaking up. I think, we've got Montgomery. And this year I was planning this summer, because of this pandemic, was to take a group down there, because our young folks don't have the history, don't understand what the church's role was. And even when I came back, it was like, for me, it was like, wow, I've got to get more involved as a clergy member in the role of the community in speaking out and speaking up. As I said, I really believe we've gotten comfortable because things seemed good, some things seemed okay, even though we were struggling, we're still making it. But I think what we've been challenged now between this health pandemic and this racial pandemic, where either the Black churches either got to put up or we're going to be dismantled. And so that's what folks are saying, like, Where's the Black church? Where's the Black church? We're here, but I think coming together as a people to say, okay, you know what? No, this is racism. Giving our people tools, how to speak up on their jobs, how to speak up in different systems, the health, as Dr. Bell said, talking about the history of mistrust. It's not just the history, but the present mistrust that we still have with the healthcare system. And how do we navigate that as women of color, Black women, and, getting medical treatment, and still we have a rough time about that. How do we educate that? How do we speak out about that and fight the powers that be? So I think this is so important for the Black church, so that we've got to be seen relevant again. And I think that's what's happened. A lot of people didn't see the Black church as relevant, but I believe the Black church is still as relevant. And as we come together to speak out and speak up on issues.
Yeah, it's interesting that you said that, because the one thing that inspired me to be where I'm at is really that intersection of moral voice and public life. And when you said, talk to the powers that be, many people perceive that to be Denise and myself. And the one thing that I would say in the context of our faith communities, in the context of the Black community, even though our ideas may differ, I think there's a value proposition of understanding what it takes to be in these leadership roles, what it took to become Dr. Bell, what it took to become, the two of you, what it took to become, the mayor of the city of Cambridge as a Black woman, and myself. And there are ways in which you could still collaborate and work together. And I think because of the moment that we find ourselves in, where what rules the day is heightened tension. Yeah. And there's this loss in the conversation that we're having to move things forward. And listen, I will have a bullhorn and a clergy call in a minute and protest. And I also know that now I'm on the other side of government, that there are people in these places that are willing to do the work and need the backing of diverse communities. And I would love to hear Denise actually perspective on that, as someone that is perceived as a decision maker in a place of power.
That's an interesting question. And I was just having it with someone in terms about outreach. The city tries to do fairly decent outreach. I'm always saying and pushing to saying, when you're doing outreach, you're never done. You're never done. It's not, okay, I did this and now it's over. We've done it. That's not the case. And it's really hard because sometimes people don't come and speak up. They don't come to public comment and complain, like other folks. And so how do you continue to let the governing body say, just because they're not here does not mean they don't need the help, the support, the vigilance that you pour into people that are the squeaky wheel, if you will. And so pushing the city to do that has not been at all easy. And I will often say, if you do the same thing the same way, you're going to get the same results. How do we make things a little bit different? How do we proactively reach out to the interfaith community in a continued and sustained way? How do we make sure that the people that are doing the outreach around testing, treatment, and all that goes with it are looking like the people that you want to receive? And then trying to get, and this is the hardest part, policy initiatives on the books that say you will do it. And that's what's, I think for me, when I think about it, the most important is it's not enough to have it as a procedure. It really has to be a policy, an order, a law. I call it in the DNA of the government governing body, because I can't speak for you, Manikka. I'm not going to be here always. And what's going to be left in place to make sure that we have a concrete, consistent, well thought out plan and procedure to get what I call, to reach out to those marginalized communities so they no longer feel marginalized and will come and participate and will go, and because we say it's important for them to go to in the case of COVID, to get tested. But the most important thing is to participate and be heard. And that I find has been the hardest, because sometimes people will say, well, that's what you're there for. That's what you're
Yeah, I think it's interesting, and I know that like we're hitting the hour of where we're gonna have to close out. But I think that's interesting, and I think it goes back to something Dr. Bell mentioned earlier, the nuance of this moment, right? And so I think there also has to be a space in public life for clergy people and trusted leaders and
Mhm.
elected officials that are really trying hard to figure out what are the data points, what's the direction of this virus, and how do you then make decisions on it? Because I think that the way in which we have conversations in the public sphere does not allow for nuance at all. And this thing, if it was something that we could fix, every single last one of us would have the answer and it would be done like that.
Mhm.
But it's hard. And so I'm just curious, as we continue to be the messengers in our respective communities, how do we push people to provide grace and understand nuance when it comes to this virus? Because from my vantage point, those are the things that's missing in the conversation right now.
And we just
Um,
add to that, Manika, because I know we're running out of time. And part of the reason why I wanted to have this conversation, we want to have this conversation, is the whole idea that this is going to surge again. So
mhm.
not to let your guards down. So Dr. Bell, did you want to lead us off? Or?
Yeah, and I think that having forums like this is very important because one thing we've learned from this virus is that all of the traditional ways in which we separate and silo ourselves in society, whether it be our profession or walk in life and what we look like, the virus has completely broke those barriers down. All it needs is another human being to be in close proximity and have their guard down to have another infection. So our response similarly has to be to break down the barriers that we traditionally erect between ourselves, whether they're perceived or real. So having a forum where we're talking with clergy, with people, school officials, with elected leaders, with public health professionals, and with physicians. I know Reverend Bowman is many of those at the same time right now. But this conversation needs to cut across the lines that traditionally separate us. That's the only way we're going to combat this, by having this interdisciplinary conversation so that we can make sure we can tailor the message to people who will respond to it. There are some people who will respond, who are listening to this, who will respond more to medical advice coming from me. There are some people who will respond to the advice coming from the school officials. There are some who are going to trust more what's coming from our elected officials, and some more from the church community. We have to be able to have the same messaging and that means we have to talk with each other and plan together and coordinate together and consistently message together so that we can make sure that we speak with one voice and that we are doing the best that we can in a unified front to combat the virus.
Claude?
Yeah, just want to add that, again, giving credit to what we've seen in Cambridge. Again, we have been in this space for many months now, combating this virus. We've done fairly well comparing us to the other 350 cities and towns across the Commonwealth. It's not to be boastful, but to Dr. Bell's point, this could change in a New York minute. So the point here today is to make sure that we remain vigilant. We are making testing available, especially around the area hotspots. There's been a lot of chatter around testing in general. The messaging, again, to Dr. Bell and other the faith leaders' points, this is something that we have to manage within our own spaces to try to push this out. We cannot take our foot off the gas pedal. And that's really been the whole point of this discussion this afternoon. With that being said, doing the work in Cambridge, having served in other places, and at least on national posts, representing the community of local health departments, I can tell you that whether it's 4 months ago where it was public health versus the economy, or the last couple of months, public health versus public safety, and now public health versus schools, just know that whether we're viewed as heroes or as villains, we are in the space where we are expected to translate. So we're here to serve. I am a public servant. I do want to commend and applaud the leadership in the city for what we've done so far, but we're not done yet. And so I just want to underscore that you've got to trust the people and the process, recognizing that this is something that we've never seen before yet in Cambridge compared to other cities and towns across the Commonwealth. And I would say even across the country, we're doing fairly well. So speaking from the vantage point of the city's health department, I would just say that what we do to impact the Black and brown folks in the community also applies across the spectrum of all those who live, learn, work, play, and pray in the city.
So as we near the end, that went entirely too quickly. Are there any last thoughts? Anything that we missed? Something that you wanted to say that you didn't get to say? I'd like to give you this opportunity before I start to thank people and talk about what we're going to do next, and just kind of wind up. So is there anyone that wanted to add another thought or point that got missed or needs to be reiterated?
Well,
I
I
just
have
think that
a quick request that I have a high expectation from my Reverend colleagues that they're going to leave us with a good word to close us out. So give me a word, give me some hope, Reverends.
well, just looking at the panel, I mean, we've got the community, we've got government, we've got science, and we've got faith. And we, all of us working together, we can be successful. It takes all of this together. And as Dr. Bell has said, one voice, one message. We're not at odds with each other. We've got the same goal, and that's to beat this virus, to beat this pandemic.
I agree. It's time for us to come together. I think you said it, Reverend Councilor Manikka Bowman, that it's time for even Black folks to come together to work together. And so we've got to come together to work together, to lift each other up, to make sure that we succeed and that we leave a legacy. So I think it's not just about even what's going on currently, but folks, you want to take care of yourself. You want to do these things so that there's a legacy. And so that there's a lot of what we need to say. And so it's not just looking at, I think, the past, but look at our present, but let's give people hope for the future. And that's legacy building and talking about legacy. So building us up health-wise, building us up economically, so I think all of this needs to be one conversation where we all come together, all, as Reverend Washington says, all of us sit down and not get called in when there's trouble. But how can we sit down before the trouble and be proactive? Because usually what happens is we wait till, all the rush. Okay, let's call in the curtain. Let's call in this one. That's too late. It's time for us now to be proactive and get on the forefront of all these different issues.
Thank you, Reverend LORRAINE. And thank you, Reverend Washington. You gave us our message, one voice, one message. So you're going to see that on t-shirts and other ways to get out to the community. I just can't thank each of you enough. Reverend Thornhill, Reverend Washington, Claude Jacob, Dr. Bell. It's a pleasure to get to meet you, and rest assured that you may be Manikka's friend, but you're now a part of our family, a family of experts, and we'll be calling on you again because someone said it, and I apologize for not being able to say exactly who. You can't say it once. You have to say it the same way, and you have to say it over and over and over. And I like the 4 T's: testing, treatment, tracing, and trust. Maybe we start with trust, but I think that's the one message that we have to give with one voice and push it out to our community, because Claude Jacob in our earlier conversation planning for this saying this is going to surge again. Now, it may not hit Massachusetts as hard, but it's going to hit us, and it's going to hit the Black and brown community the hardest, and we have to be prepared. So again, thank you for your time, your talent, and your treasure for being here this afternoon. To our viewing community, I want to thank you for joining us. Manikka, before I close this out completely, do you want to have any parting words?
It's just always a joy to do this with you. I'm really elated that CCTV pulled us by our coattails and said, hey, you're not going anywhere. So it's just been a joy to be able to do this for the Cambridge community and beyond, because I know that there are viewers that's looking from other parts of the country that joins us every 2 weeks. So thank you to our participants. Thank you to the Cambridge community, and thank you to CCTV. And we will continue the conversation, right?
Thank you for saying that, Manikka. So as we close out, I want to remind people, because CCTV is is the rock that we stand on. We're going to be hosting another conversation on Thursday, the 13th of August, in observance of women's suffrage. You'll notice I did not say celebrate, because African-American women had nothing to celebrate around women's suffrage. So we're going to have a discussion on that. It's going to be from 6 to 8 here at CCTV. I hope you'll join us. As you've joined now, you'll join us then, and ask a friend to tune in. Again, thank you, everyone. Take care of yourselves and each other.
Be well. Bye-bye.
Bye.